guys, in this lesson, we're going to talk about premature ventricular contractions, also called PVCs. We're going to break down the characteristics of a PVC on an EKG and talk about nursing interventions and treatments. So let's go ahead and get started. So in a premature ventricular contraction, there is an additional stimulation in the ventricles that causes the ventricles to contract prematurely. So if you look at this strip here, we have a P wave followed by a QRS. Except right here, we have a abnormally looking QRS complex that comes before it's supposed to, and that's a PVC. What happens is there are irritable cells in the ventricles that produce an additional firing across the ventricles, causing the ventricles to contract before they're supposed to. And when this happens, the ventricles have less time to fill up with blood, so the cardiac output is decreased during a PVC. And the complex is usually wider looking because whenever let's say this cell decides to act up, it sends a signal across the right atria, so the right atria contract. And then, the right ventricle, so the right ventricle contracts. And then it goes to the left ventricle, so the left ventricle contracts. In a normal looking QRS complex, both ventricles contract at the same time. So here, during this PVC, because it's going across, it takes longer, so the QRS complex is wider. Now, just like in PACs, you got to have an underlying rhythm. Can't just have a bunch of PVCs, because that would be another rhythm that we'll talk about later. Got to know the underlying rhythm. So let's do the 6-step method and break down the characteristics of the PVCs on an EKG. So in step number 1, we look at the rhythm. Do we have a regular rhythm or an irregular rhythm? And actually, on this particular strip, I know that it's a sinus bradycardia, so I would call this a regular rhythm and irregular during the PVC. However, the regularity just depends on the underlying rhythm. If I was to have AFib, I would obviously have an irregular rhythm. So it just depends on what my underlying rhythm is. In step 2, I count the heart rate. So here it would be 40 beats per minute. You got to include the QRS complex during the PVC in the heart rate. Sometimes when patients are connected to the monitor doesn't always sense the QRS during the PVC. So if it was picking up this particular one, it would give me a heart rate of the 30s. So you always got to go back and double check it yourself and count the QRS complex during a PVC. In step number 3, we need to do the P to QRS ratio. Do we have a 1-to-1 ratio? And that depends on the underlying rhythm. Because our underlying rhythm here is sinus bradycardia, we would have a 1-to-1 ratio, but it is actually not measurable during the PVC. So again, it depends on what your underlying rhythm is. In step 4, we got to look at the PR interval. And again, during the PVC, it is not measurable because we don't have a P wave. If you were to measure it any other time, it just depends on the underlying rhythm. And in step number 5, we look at the QRS complex. So let's measure the one for the PVC from here to here. We have about 4 boxes. So that would be 0.16 seconds. And if you look at the QRS complex, during the normal ones, it's about 0.08. So it's normal for the most part, but during the PVC, the QRS complex is a lot wider. And in step 6, we identify the rhythm, which we have sinus bradycardia with PVCs. Again, depending on your underlying rhythm, or if my heart rate here was 60 to 100, I would call this sinus rhythm with PVCs. Or if it was over 100, I would call it sinus tachycardia with PVCs. So it just depends on the underlying rhythm. Because the irritability is occurring in the ventricles, it can occur with any rhythm. You can have AFib with PVCs, a flutter with PVCs, heart blocks with PVCs. PVCs come along whenever they feel like it. So let's go ahead and talk about managing it. So most people that come in with PVCs, their presentations are a skipped heartbeat and pounding heartbeat. And this depends on how frequently the PVCs are occurring. The nursing interventions for PVCs are to determine the underlying rhythm. You got to know what's going on. And you got to find out the frequency of the PVCs. How often are they occurring? Because if it's just every now and then, it's okay. We can just continue to monitor patients. But if it's happening more frequently, we got to do something about it. Now, if you've ever heard the term patients having bigeminy, what this means is that they are having a PVC every other beat. So if you look here, this is a normal QRS complex and then PVC. Normal, PVC, normal, PVC. So if it's every other beat, it's bigeminy. Every third beat would be considered trigeminy. So we would have two normal QRS complex and then a PVC. That would be called trigeminy. So again, always know how frequent the PVCs are occurring, because that can actually predispose a person to going into VTAC, and you got to prevent that from happening. So let's go ahead and talk about how to treat PVCs. So the therapeutic management for PVCs are to determine the cause. Just like in PACs, caffeine can cause it. Electrolytes imbalance can cause it, especially potassium and magnesium. Hypoxia, some medications can cause it, and an MI. So always find out what is going on so you can hopefully determine the cause and treat it. Now, because PVCs are common and a lot of people have them, a lot of people are asymptomatic. If they're occurring infrequently, they're just not, they're just every now and then, that's okay. We continue to monitor people. Now, when they become symptomatic, it's usually because the PVCs are occurring frequently. They may be in bigeminy. We got to do some medications like antiarrhythmics or some beta blockers and calcium channel blockers. If that does not work, people will usually have an implantable cardioverter defibrillator implanted. So basically, what it's also called an ICD. What that is, here's my patient. They got funny looking arms. I can't draw. There's a hand. So under the skin, the little ICD is implanted, and the wires go to the heart. Yes, I understand the heart's not that low, but go with it. So the wires are in the heart. So what that little defibrillator does is it senses if a patient is going into VTAC or VFib. It senses that rhythm and it shocks the heart so it can go back into a normal sinus rhythm. It's kind of like walking around with your own defibrillator and being connected to the pads. Anytime an lethal abnormality happens, it's going to shock it back into normal rhythm. And if that doesn't, or if that does work, or people are still having frequent PVCs, they can have an ablation where that little part of the ventricle is burned so that hopefully it quits sending off an electrical stimulation. So let's go ahead and recap and talk about the key points to PVCs. Got to remember the abnormalities. It is an early contraction of the ventricle, so we will see a wide QRS complex, usually greater than 0.12 seconds. Now, nursing interventions, know your underlying rhythm. Got to know the frequency of the PVCs. If they're not happening too often, we continue to monitor patients. If they are occurring more frequently, we got to do something about it. So the treatment depends on the frequency of the PVCs. So I hope that you guys have enjoyed this lesson and have a better understanding of PVCs and know the characteristics of it. And of course, management of PVCs. Make sure that you check out all of the resources that are attached to this lesson, and make sure that you guys go out and be your best selves today. And as always, happy nursing.